The teens are difficult years, am I right? You know, there's fitting in, there's exams, there's going to university if you're leaving school. There's lots of big events. All the while, hormones are flying around, and 85% of teens are getting some degree of acne, which can be really quite severe. So how do we help teenagers achieve the best possible success in their skin? So that's what I want to do today in this video, is share with you the tips and tricks that have made all the difference when it comes to transforming the skin of somebody shy, head down, hair forward, self-conscious in their skin, into somebody who feels proud, whose head is up, their hair is back, and you can just see the difference. I want to share those tips and tricks with you today. So what is it about the teenage years that causes so much havoc in the skin? So when puberty kicks in, the adrenal glands and the sex glands turn on and produce hormones that activate the sebaceous glands, which are most dense in the T-zone, to some extent the cheeks, but also the chest and the back. What that means is oil production increases, the skin becomes more greasy, so visible shine, what we call combination skin, if it's just affecting the T-zone. And it also causes the skin cells that are always exfoliating from the surface of the skin to become sticky and form little clogged pores, or what we call comedones. Again, most typically in the T-zone. Blocked pores, too much oil. The bacteria that causes acne, which we'll see acnes, has a party in the hair follicle, and that triggers inflammation. So that can then lead on to the blemishes that we know and associate with acne. Those can be papules, which are red small bumps, pustules, red bumps with a white head, to the larger ones, which are nodules and cysts, and those are the ones with the risk of scarring. So it's a constellation of all those symptoms together that we term acne. And the thing is, it can cause upset and bother, whether it's mild or severe. Now, today I'm coaching you on how to put together a skincare plan. So if there's signs of scarring, where there's actual indentations in the skin, that's a sign that you need medical intervention. That's definitely time to go and see your GP or make an appointment with a dermatologist. So I'm not going to cover that in this video. Today is about building a structured routine for the mild to moderate severity of acne. So the first thing to check is, do they have the right toolkit? Because so often the breakout market in terms of skincare products available treats every teen like they have super oily skin. So you find harsh foaming cleansers, you find physical exfoliation, you find alcohol containing astringent toners. Things that some way along the line, somebody said that people with acne need their skin stripping in order to get better. We know better now. We know that breakout prone skin needs to be carefully managed to avoid further irritation of the skin barrier. So I think giving your teen the proper basics to set themselves up for success is really important. Now, cleanser, moisturizer, and sunscreen are things that everyone needs to have access to when they're trying to manage breakouts, because those things will help support the skin so that you can actually use the active ingredients that make a difference. So ingredients like retinoids and anti-inflammatories, but you gotta have the basics in place first. And it can seem counterintuitive using moisturizer in skin that's already oily, but it really is the way to ensure that compliance with your active ingredients actually happens. So the right tools for the right job, super important. So the next thing to think about is, have they got the right information? Now, whether that's a plan that you've discussed together, or whether they're sourcing information how to manage their own skin through the internet, it can be really difficult. And that's why patients come to see me for a structured plan. So I think that in order to do acne treatment well, you have to have the right expectations. That's the first thing. And you know, if you believed what you see on TikTok, you'd believe that everybody should be solving their acne overnight using a sea salt spray and a piece of ice. So we know that's not the case. So I think it is really important to have that sort of open channel of communication and to get involved gently and with compassion and with care. And that's true even for patients that come and see me in the clinic, where I walk them through each part of the routine. Literally, this is how you use the cleanser, this is how you moisturize, This is how you use sunscreen. This is how much. Here's your retinoid. Here's your anti-inflammatory. Again, here's how much. I ask parents to sit with their teenager and go through it. We give them a plan. So it's all really structured and clear because, at the end of the day, it's very easy to get it wrong, to use too much, or to get the order of products wrong. So sitting down, communicating, maybe helping, watching, assisting while they do their routine, and generally supporting them in whatever way they need so that they can talk openly to you about what's going on if something's going wrong. Because what we know is that people get fed up with acne treatment. And I think it is largely due to a lack of education. Up to 30% of retinoids topically don't get used when people check into compliance. So it is a real problem. I think the way to get around it is to talk about it, to have a plan, and to be there to answer questions and support and to educate yourself so that they come to you when they have a question rather than just pushing the product aside and, finding a mask instead. So on the subject of clear communication, do you know what else they might be using aside from those basics and active products that hopefully you've sourced together? Just because we all share things that we're interested in, and skincare is one of those things that gets shared amongst friends. And oftentimes the things that are fashionable are less useful when it comes to treating acne-prone skin. So be particularly aware of things like long-wear makeup, primers and setting sprays, cosmetic trends, which are not the friend of those who've got breakout-prone skin. And if you think cosmetics might be playing a role in your teen skin becoming worse, consider going shopping with them for some suitable cosmetics. I've done lots of content on brands that are suitable for breakout prone skin. So they still have access to concealer and foundation if they feel more confident that way, but you know that it's not making their breakouts worse. And then the last thing I want you to think about is checking the bits that they might not tell you about. So chests and backs. I find that teenage boys are often really quite shy and reluctant to tell you about breakouts on the body, but upper backs and chests can scar quite easily. And again, if you don't ask the question, you might not know. So do find out, because a good skincare strategy can work equally well on the body. Or if it's at the more severe end of the spectrum, then it definitely is worthwhile getting medical attention, because it can be difficult to treat large areas on the body with topical treatments if things are quite active. Now, Dr. Emma's done a really good video a few weeks ago, which I'll link to, on treating body acne, because you can get good results, as I said, with topical skincare, but you need structure. So at the end of the day, helping your teen treat their acne is all about the right tools and the right communication with a hefty dose of education thrown in. And it really is an empowering thing to do for your teen, because we know that a lot of teens go on to have acne into adulthood. So getting a handle on it can make such a difference to their enjoyment of life in general, and also, gives them energy and kind of focus on things like their studies or sports or whatever else, because they're not worried about their skin and feeling self-conscious. So it really is a great thing to do at a really important time in their lives. And I hope that today I've given you some pointers that might help improve your teen's journey with their skin. Now, if this was helpful, please do feel free to give it a thumbs up and share it with somebody who you think might benefit from it, so we know that we're reaching as many people as possible with the content. And I'll see you again very soon. Bye for now.